Everyone, we've got a couple of minutes. We're just going to wait for the rest of the people to filter in and we'll get started. My name is Dr. Vanessa Pomarico, and I am so delighted to be here tonight to talk about excelling as an NP Preceptor, tips and tricks for clinical education. And I am delighted to be with my friend and colleague, Dr. Wendy Wright, to talk about all things precepting. Hi, Wendy.
Hi, Vanessa. How are you?
I'm good. Thanks for being here. You want to introduce yourself and let everybody know all about you for the ones that don't know who you are?
I am happy to. I've been talking all day, so I apologize for the cough drop in my mouth. But for those of you whom I've never met, I'm Dr. Wendy Wright. I'm an adult and family nurse practitioner. I am the owner of a nurse practitioner owned and operated primary care clinic located in Amherst, New Hampshire. We take care of 6,500 primary care patients, and I have 13 nurse practitioners who work alongside me every day. And we take a lot of students, and I precepted more than 100 students throughout my career. So, Vanessa, thank you for asking me to join you tonight. I truly am honored, and I hope that our folks walk away with some really cool tips.
Well, I can't imagine that they won't. We have so much that we're going to cover tonight. It's going to be a jam-packed session. And, Wendy, you're such a leader in the industry that it's so great that you're here tonight and can really share a lot of your experience. So let's start off by talking about some general challenges with precepting. Can you just talk a little bit about what advantages do you see by precepting a student?
Well, certainly precepting a student is hard, right? For all of us, there's very little pay that comes along with it. Very few organizations, universities offer any type of stipend to nurse practitioners for doing it. And it's not a simple workload, right? You know that as well as I know that if you are going to do it and you're going to do it well, it requires a lot of time. And it's a lot of time that's added on to the day. I always meet my student an hour before we're due to start. So for me, that often means I'm in the clinic at 6 o'clock and my day isn't done when we finish, which means I'm often there after 6 o'clock. But at the end of the day, there are huge advantages. One, and Vanessa, you know this from us teaching the certification course, students have a lot of time to read. And so it forces me to make sure that I am up to date with the latest guidelines. I think that's a huge advantage because students will say to me, why are we not doing it this way? Because I read X, Y, and Z. I think that the other challenge is really just, it takes a lot of onboarding time for us. Our student comes in ahead of time, they meet with IT, we give them access to the system, we give them remote access, but there's a whole training that goes with that. Then our practice manager has to onboard them and make sure that all the forms are signed to protect us from a HIPAA compliance perspective, sharing data, access to data, etc. But I feel really strongly that students need access to EHR and they need to know how to document. And so to be able to do that and to mimic what life is going to be like when you launch, I think that's huge. And then a lot of other things that I hear as I travel around the country is students cost time, but they also cost me money because I'm slow and I can't keep up with that same pace. I don't find that because of the way I set my schedule up, but I think there's a lot of challenges. And the thing about for us is we've maxed out our physical space. There isn't one more room to be had. And I need the NPs who are generating income to pay themselves and to get their bonuses to have physical space to see patients, and students take a longer time in an exam room. And so a lot of offices are really constrained by the licensure for EHR and by the physicality or the physical space that's required to have students in place.
That's a lot to balance, but those are the things that a lot of schools and the people that place students don't take that into consideration. So you talked a lot about these challenges. How do you balance all of your responsibilities as a preceptor with your own workload? I mean, thinking about things like time management, meeting your practice metrics, that kind of thing.
Well, Vanessa, I'm pretty lucky in that I am the owner of the clinics. So for me, if I don't meet a metric, it just means that there's less income to the clinic, which is huge, right? But I'm not under a supervisory, I don't have someone sitting over my head who's counting the beans. However, I am the bean counter. And so what I have done for the last 15 years with my students is I don't have the students see my patients. I'm booked now until March. My patients wait for me. I'm in this business for 32 years. I see patients 28 hours a week. They want to be on my schedule. And so I feel terrible about offloading someone who's waited a year to see me for a physical to see someone else. I just take that. It's tough for me to do that. So here's what I do. And this works, I feel like, best for everyone. I have my schedule and I have my students have their own schedule in the EHR system. And what that
Interesting.
allows me to do is to work in tandem with them. Like if I start at 8, they start at 8:30. They're double booked, so they've got a good hour or 2 hours if it's a physical. And so it allows me then to see patients while they're seeing patients. And I don't do this obviously with a first semester student, but for me, I generally don't take first clinical students. I take second and third because I just can't do that with the schedule that I'm maintaining. So they'll have probably 3 to 5 patients when they start. And by the end, I like them to see about 6 to 8 patients in addition to the schedule that I'm already maintaining. And at the end of the day, what that does is that increases my capacity because I'll have the triage nurse say, Wendy's working with a student today. You're going to see the student, but Wendy's going to come in and double check. So you're going to see her today. And people have been really receptive to that. Plus, it increases my revenue by at least 50% because the student's working alongside me. And it's really, adding a third to my capacity or a half to my capacity.
That's a great way to be able to do that. We have such a space crunch where I'm at, and I'm on the other side of it, that there are bean counters on top of me. Although I will say that I'm in a very supportive environment and they actually want us to precept, especially we look for the nurses within our own health system who are going on to NP school, but we just don't have the physical space. And although my patients aren't waiting a year to see me, but many of them are waiting 4 or 5 months to get in, a lot of them right away, they all know that I have a student, and right away, my medical assistant will always say, Vanessa has a student today. Do you mind if the student comes in? And they'll say, let the student come in. They love being part of that process. And I have a couple of other patients, rightfully so, that they don't want them. And that's okay. That's when this student will be looking up something in the office or whatever. But it's really hard because because of the time constraints and the room constraints, that I don't have the ability to double book like that.
I get it. And I think that People need to also realize that depending upon your certification source, precepting a student counts toward your recertification, right? I'm ANCC accredited. I'm an old one. That was all that existed when I came
Right, me
to school.
too.
But that can be really helpful. And I will say to you, I think that the staff loves the students. And one thing I didn't mention as an advantage is I always take students when I know we're going to have a position open. And so what that allows me to do is mentor them for a year. I essentially have given them a year of education when I know that I'm going to be hiring. And it allows me a year of interviewing someone to see if that person is going to be a strong fit for our clinic. So that's a huge advantage for me is I've tried these patients out. I'm sorry, these students out to see. And I tell them when I interview them up front to come on board, we're likely going to be hiring. So if this is a place that you feel good about, please make your intentions known because we are interested in looking at hiring you if all of this works out well.
That's wonderful. So on that vein, before you take a student, what are some of the processes that you go through before you actually accept the student into your precepting office?
So some of the worst experiences I've ever had is when I've been guilted into taking the student without ever meeting them before. I'm sure you get this. Hey, my friend is becoming an NP. I know you don't know her, but could you take her for me? And I've had some not good experiences with students. So now I will not take anyone. I don't care. Vanessa, I love you, but I wouldn't take your friend if I didn't interview them because I want to make sure that they're a good fit, not just for me, but a good fit for my clinic. Because as the old saying goes, one bad apple can spoil the whole bunch, girl, right? And so I want to make sure that that person understands I'm an NP led clinic. I'm an NP owned clinic. I feel like the bar is really high. And I want to make sure that the care that's delivered in that clinic is comprehensive. I want to make sure it's evidence based. And if that person doesn't seem to fit, I'm not going to bring them on. And I usually say, I'm interviewing a lot of students. Please don't feel badly if we don't accept you. We have very limited spots. But I have probably not accepted 50% of the people that I interview because we just have a lot of demand, as I'm sure you do. But what we find for us is a lot of NP students want to be in an NP owned led clinic to just see what that's like and to feel out how different is that than other traditional practices.
And it's so different because we come from completely different practices. I work for a very large health system. We have over 140 offices over 3 states. And so it is a very different feel. We were talking a little bit about, interviewing the students and that kind of thing, and I, like you, I've been burned far too many times taking somebody's friend or somebody's sister, and then they turned out to be less than stellar. And it's been a difficult process. How do you address some of the different learning styles with your students, like teaching them time management and that kind of thing?
So we have a protocol that we work with all students. Like it's kind of this cookbook recipe, but what we'll do is we'll modify it as we go along. So our practice, so I told you IT meets with them, onboards them, trains them in the EHR, and we have videos that we ask them to watch. We also have practice patients and I say to them, I'm not here to teach you an EHR system and I'm not going to. You need to come having prepared using the videos that we provided for you. My job is to teach you differential diagnosis, prescribing, thinking, clinical skills. I'm not teaching you how to use an EHR. So come prepared. And I'm tough. But as I always say to people, I am tough. I'm kind, but I'm tough. Because when you walk out of here with my name on your resume as your preceptor, there is a bar that I ascribe to. It's what my preceptors ascribed to 32 years ago, and I'm not going to relax that bar. I'm going to know that you are ready to go and to graduate. So then what happens is they're onboarded by our practice manager, who then again does all of the forms, but also kind of goes over with them kind of simplified steps on how to do this. And then at that point, what I'll do is we come in early, an hour before, we look at the schedule, and for the first couple of weeks, I have them following me. I want you to follow me. I want you to listen. I want you to write things down. And then what I'll do is I'll offload a couple of the charts to them based on what we've talked about so that they can try to do some documentation. But then week 3, my goal is I want them seeing at least 1 to 2 patients in the morning and 1 to 2 in the afternoon, where they're going to go in, take a history, perform a physical, come out, and I say to them, you need to present to me and assume I know nothing about this patient. Because I think one of the skills that needs to really be practiced is presentation skills.
Mm-hmm.
You need to get my attention in 1 to 2 minutes. And you need to tell me when my ears need to perk up. And so I practice with them every patient. Here's what I see, here's what I hear, and here's what I think, and here's why. And my pearl is, I always say to them, I want what you think it is and why. I want one thing that you would never want to miss giving that presentation because it would kill them or hurt them, and why you don't think it is. And then I want 2 other things, 2 other differentials that you've thought through and why you think it is not. And then I say to them, I want you to document that. And I will verify all of that and work with them on documentation, medical, legal protection, etc., because that's a baby of mine. And I think that I then get a feel of where that student's weakness is. And then the next week when we meet, I'll say, here's what I think you did really well last week. And this week, here's what I want you to really work on. I feel like before you come to me, you need to take 2 minutes to look things up. You need to be thinking through, because I can tell you in a minute what I think is going on, but that's not going to help you. You need to come up with something yourself. We live in this instantaneous gratification kind of society. And I could tell people in a minute what I think it is, but that's not always the best learning style. And I'm fast and I'm to the point and I'm brutally honest. And I'm pretty honest when I say to a student, you've got some work to do. And I've been told that my first semester in graduate school, one of my professors said, how long has it been since you took a physical assessment course? And I said, by the tone of your voice, way too long. She said, you've got some work to do. And I did have work to do, but you know what? It made me a better NP. And so I think that presenting it kindly, but affirmatively, that I can't turn you loose if you can't do X, Y, and Z. And so this is what I want you to prepare for. And I want you to prepare for these these patients. We give them access at home. So when they come in that day for clinic, I expect them to have looked up the patients that are already on their schedule and think about the messages that are in their chart and why those patients are coming in. So that's kind of how I work it. And I know there's a million ways to do it, but that's just kind of the routine that I've settled into.
Do you find, I know that I find this depending on the school, that different schools prepare, even though they're all meeting the same standards and they all have the same educational requirements to meet. But I find that some particular different schools, the students come in and they are not as prepared as other students should be in terms of things like not learning a differential diagnosis. When I had a student with precepting with me, I did exactly as you did. I want you to give me, 3 different differentials. Don't come out, present it to me and say, patient presents with X, Y, and Z, and this is what they have. You missed everything in between. And when I say differential diagnosis, they look at me and they don't have a clear handle on what that is. How do you handle that when it's not the fault of the student, but the fault of the preparation?
So it's very interesting. I just did an interview with NOMF today, the National Organization for Nurse Practitioner Faculties. And this
Nice.
is the type of question that came up. They want to interview people in the stakeholders. And what can we do to improve NP education? I think that not every school is the same. And I think that not every NP is the same. And so I think sometimes it's a combination of both. But there are some programs that certainly do not offer the same support as other programs. I will tell you, I had a student 3 or so years ago who spent 4 months with me, and not once did I hear from faculty. In my opinion, that is unacceptable. Now, this student, it was phenomenal. I didn't necessarily need to hear from faculty, but it's always nice to get an email and say, I know you're out there taking care of my student. How is she doing? And so I think that my response is, there are certain programs that I now limit my preceptorships. I don't accept from certain programs, mainly based on the fact that I felt that I've been burned before. And as I said to one faculty member, it is not my job as a clinical preceptor to teach a nurse practitioner how to do a physical examination. That's a skill set that they ought to walk into this clinic with. And if you can't provide it in your didactic and in your experiential training, I can't be a preceptor for you. But I also recognize that you can come from a really good school and have a struggle. And you can come from a not so good school and be an amazing NP. So I think that it's a lot of what people put into it, but it requires dedication on both parts. And if students feel like they're not getting what they need, then as a professional, it's you speak up and you do what you have to do to make sure that when you go to the setting, you are prepared.
Exactly. You know, we've seen so many programs. This is kind of going off a little bit, but and I've noticed this, that so many of our brick and mortar programs have now gone online. And I know that I've seen a big difference, a drop in the skill set for hands-on physical assessment because they're learning it online and they don't have that hands-on experience. Have you noticed that at all with any of your students?
So, I've certainly noticed that education and preparation is different than it was when I was there and when you were there. As I said today, it's very interesting because we live in this society that thinks, oh, this is the reason or that is the reason that things are changing. I mean, Vanessa, you and I spend 5 days a week in a brick and mortar school. It's a different world. But I will also tell you, I did my doctorate totally virtually. So, but I also didn't need them to teach me how to do a physical assessment. I needed them to teach me how to be a better leader and researcher, etc. So I think that, and I just want to say one other thing. People come up to me at conferences and they say, I think the problem is really this direct entry thing. And I say, actually, some of the NPs that work in my clinic are direct entry and they're amazing. And I say to them, I was a nurse for only 1 year. Back in the day, when you needed to be a nurse for 2 years to even think about going to an NP program. And I don't feel that I'm a bad NP. And I often say this, I didn't need to learn how to do a swan line and A line in order to be a better NP. I had the skills. And while it may have only been a year, I knew what I wanted to be. And this was so important to me. So like everything in the world, there's good, there's bad. What we have to do as preceptors is to find a way to meet the students where they're at. And if we feel that there's a pattern in the lack of preparation from a particular cohort, it is my job to take that back to faculty and to take that back to the deans and say, I need you to know, don't call me anymore. And here's why. Because I feel like this is what is happening to me, and I don't have time to spend days teaching the NP skills. I need to teach them critical thinking and decision making and help them to understand that when you write that script, you can kill someone. So you have to understand not just how to prescribe a drug, but the pharmacology and what it interacts with, etc.
So important. And, like you, I did the brick and mortar for my FNP, and then my doctoral program was completely online. But like you said, we didn't have to worry about learning a physical assessment. And like you, I also request to take students who are in their second or third rotation, but I have had special requests to take a first semester student, which has always proven to be a lot more of a challenge than my schedule actually allows for. And when the students come in because they were not learning that hands-on physical assessment, I took the time afterwards to say to the student, come in an hour early, let's stay an hour late, but I need you to show you how you palpate a thyroid because you're not palpating a thyroid under here. I need to teach you how to palpate the abdomen and percuss a liver and all of those other things. You know, I have a reputation like you, and I say the same thing. When you leave my clinical, my name is on, you know, my stamp is on you. And so I need to make sure that when you leave here, you're doing the right things. And it's sometimes hard for students to hear that constructive feedback. I try to be very mindful on
Yeah.
how I approach them. I always like you to talk to them about the positive things that they're doing and the other things where they need to learn. I almost feel like I'm a judge on Dancing with the Stars because, you know, every week you want them to improve on something. But what strategies do you have to give your students constructive feedback?
Yeah. So I'm tough, Vanessa. I struggle with this a lot because I'm brutally honest and sometimes to a fault. So I always have to, my sister runs my clinic and I always say to her, what I want to say to my employee, the people who work for me is put on your big girl panties and just shut up and just do your job. And she's like, please don't say that to them. Will you please just let me handle stuff? Because I am really like, oh, come on, guys, let's just do your thing. So I understand. I try so hard to lead with the positives. Here's what you're
Good.
really good at. But as I said to my son, you don't just get medals in the world for showing up. It's just the way it is. And it's one thing if you're scanning groceries, no offense, whatever that is for someone's life, but these are lives. And these are people that if we make one mistake, they can die or life forever can be harmed. And when I lose that in my brain and I don't think about that every day, it's time for me to get out because I've become too complacent. So I will say, here's what I'm worried about. And I never, ever fill out a student evaluation without having talked with that person before. And I say this in my clinic with the peer reviews that we all do. Do not dare rip someone apart if you have not had the courage to have a conversation with them first and say, this is what is bothering me, or this is what's worrying me. And I feel that same way about students. And I'll say, listen, I'm not here to flunk you. I'm here to make you the best NP I can make you. And I tell them the story about my professor, and I love her. We've been friends now for 32 years. I thought she was going to flunk me out. I went home that night. I cried to my husband. And do you know, for the next month, my husband sat there while I practiced that physical exam every single night, to the point when he went to see his own physician, he said that was the worst physical exam I've ever had, because he knew, like, head to toe what a full physical exam will look like. And so I try very, very hard to just give that constructive feedback, but people need to hear if they need to improve. People need to hear if they need to improve. So
A nurse that I worked with many years ago, her favorite saying was, nobody was born knowing.
oh, I
And
love that.
and Immaculata Alba, she was an absolute gem. But that always sat with me. And again, as I try to give that constructive feedback to students, it's sometimes well received, and I tell them this is not meant to be, a criticism, but it's meant to help you be the best nurse practitioner that you can be. What happens when you have a student that maybe there's a conflict or some kind of misunderstanding with the student? I know how I handle it, because I'm pretty much head on. Let's just deal with the elephant in the room so we can move on. How do you handle that?
This is a tough one. If you would allow me, I'd love to share you an experience with a
Please.
student. Okay. So Ronald Reagan once said, trust but verify. I never really endorsed that much, but students have to fill out the times that they are in my clinic, as with you, and they have to record who they saw and what they did. And so I took a look. I don't know how I saw this. I think the student submitted me the paperwork. And as I looked at the paperwork, I realized that the patients that she said that she saw, she had never seen. And so I said to her, I'm very confused. You listed out hours and you listed out patients that you had never seen. Help me to understand what that's about. And she said, well, they're on your schedule. And I looked at their charts, so I just listed them. No, that is not a patient you saw. You never met them. You never interacted with them. So in the world of medical malpractice, you don't have a relationship with them. So I feel really uncomfortable about this. And she said, oh, well, we were told that that's what we could do. And I said, okay, so let's get your faculty on the line so we both have an understanding. She's like, no, that's okay. I just won't do that in the future. Well, at that point, I clearly knew that this was a misrepresentation of what was being done. And I said to her, we can handle this one of two ways. I'm a big girl. I know how to handle things like this. I have employees, etc. And I actually said, I can go to your faculty and explain what has happened here, or you and I can calculate out the hours that you really did not see patients. And you and I can make sure that those hours are made up. I don't want to go to your dean or your faculty, but we've got to figure something out because you're telling people that you did more hours here than you did, and you saw more patients than you did. And she said, okay, well, let's work it out. And so what I did was I added more hours. Now, people in hindsight have told me what you should have done was you should have gone to her dean. That's dishonest. It's misrepresentation. Well, I can tell you that she is out in the community and is a stellar NP. You know, we live in a society where people aren't allowed to make mistakes.
Mhm.
You know, first time you're going to jail for this, or there are mistakes that warrant that. Please don't get me wrong, but we are human. There's one judge in my world. And so I know that I've made mistakes, and I would hate to see an entire career thrown away. Yes, it was dishonest. She knew it was dishonest, but maybe what I did was I taught that integrity in this business. And I actually said that if you're willing to make up something like that, are you willing to misrepresent a record as well? And I think that really woke her up. And I know that she's years out in practice now. And I follow her because I know where she is and I hear great things. And I hope, I guess, what I did was teach her integrity in this line is just so important. So we came up with a creative way, and I was told faculty should have been involved. She should have gone to the honor board. At the end of the day, I did what I thought was best, and that I'm a mom. I would have hoped maybe someone with my son would have thought, let's not throw this kid's life away, but let's work to try to remedy what they already know they did wrong. And so, again, everyone has to handle it their own way, but that was a really challenging situation for me. And I agonized over what to do. I lost a lot of sleep over that. And, but I think in hindsight, I feel like I gave her a shot at not ruining an entire career.
You sure did. That's an amazing story. And how wonderful for her that, you were able to give her that opportunity and that you thought about it. What if this was my child that somebody did that? And I think very often we have to put ourselves in the student's shoes. We don't know where they're coming from. And maybe that was the first time somebody really gave her an example of integrity. So good for you. And it's nice to know that there's a silver lining that she has such a good reputation out there in the community, because if people know you precepted her, they would come back and say, Wendy, do you remember that student you had? So that's wonderful to hear.
And I don't know if it was right, Vanessa. I just knew I needed to follow my heart and my head.
Sure.
And after it was all over and everything was done and graduation happened, I went to her faculty and said, I want you to know what I did. And the faculty was actually fairly supportive. And I'm not sure that they agreed with my decision, but at that point, it was said and done, and I waited for it to all be over. But I'm a human. I pray that people would look at me and look at my integrity and say, let's give you a second chance and not ruin your career over something that when you're young, you may not think, well, what is that all about, right? And when I was a nurse practitioner student and I had a preceptor, I was irrigating out an ear and I knew how to do it. I had done it like 4 or 5 times before, but when I did it, the little cannula basically slipped and it hit the person's ear canal and there was blood, and this person screamed bloody murder. I sobbed like a baby. I went and got my preceptor. I'm like, I'm so sorry. And she said, Wendy, it's an abrasion of the ear canal. Nothing bad has happened, but he was so angry and threats. And she said, you know what? This is a small thing in the scheme. You are a good NP. Just pick yourself up, go home, sleep on it. It's gonna be okay. And I'm so thankful for people like that because they kept me going, because we're human. You make
We
mistakes.
are. We are. And like you said, somebody gave us an opportunity. Why shouldn't we pay it forward and do the same thing? Obviously, there are
There are
other
exceptions to
constraints.
that rule, right?
Exactly.
Diverting drugs in the clinic. I mean, our students obviously don't have the right to prescribe. They can't send anything over, but they are loading drugs in the chart, breaching HIPAA. They know right up front, if you talk to anyone about this is, and about this clinic, it is a breach of confidentiality. And so you're out at that point. I mean, there are bars that we definitely need to set. Vanessa, I just want to bring up that Amber commented that she wanted to thank us for her comments about online schooling. And she said she did her FNP online and the brick and mortar school was 1.5 years out and I was ready to go now. And she said, and because I was ready, I'm a great NP. And I think that that is absolutely true. She said, I
There
don't
is.
let my school slow me down. We had to learn assessment and then spend a weekend to try to sign it off to pass. And that's what I really believe is, I probably could have gone to Harvard if I chose to. And not that they had an NP program, but I don't believe that the school defines you. I went to a school that I felt was right for me, and you can be anything you want to be with a lot of hard work and dedication. And so I know we're getting a little bit off track from the preceptorship, but I think it doesn't matter from where you come. If you really want to be good, you can be.
Exactly. And I think a lot of times, and this will be my last comment about the online programs, I think a lot of times they get a bad rap because there are people who are not accepting of it. But just like the attendee said tonight, when you're ready, you're ready. And when you are that motivated, you're going to find a way to be good at what it
Absolutely.
is that you need to be good at. So kudos to everybody that listen. I teach in an online program, but I also graduated from an online program. So I think that that's great. So thank you for that comment. I want to move into some training and support talk right now, because you and I had talked about something that was pretty unique and something that I wasn't even aware of about support for preceptors in their roles. And you're involved in something called Project Echo. Can you talk about that a little bit?
Absolutely. Some of you may be familiar with Project Echo, but it's a worldwide movement, basically, where people come together to share best practices. And I think I was involved in Project Echo, Preceptor Project Echo, for about 3 years out of the University of New Hampshire. I did stop a couple of years ago just because of time constraints, But if you go out and you Google Project Echo, Preceptor, University of New Hampshire, you will find that we recorded all of our learnings. And it was a great way for preceptors all across the country to come together to share best practices. And I have a couple of videos that I recorded. But for those of you who are wanting to precept or are precepting, I talked about in my video something called the 1-minute preceptor. And it's actually a very valid way of precepting and providing feedback. And I wrote it down for you all. It's obtain a commitment for the student. So tell me what you think is going on. Probe for evidence. Why do you think this is what it is? Teach them something. Give them a teach about whatever they're talking about. So this week I had a new fellow. I have a fellowship program in my clinic, and I had a fellow come up to me and say, this woman gets migraines every time she takes out her NuvaRing. I want to give her Nurtec to see if we can treat her migraine. And I said, how about continuous cycling? Have you thought about that? Well, what do you mean? I said, keep her on the NuvaRing. The minute she takes it out, put the next NuvaRing in. And oftentimes they won't have those withdrawal migraine because what triggers it is the estradiol drop at the late luteal phase, or when you pull that out. She's like, I didn't know that. See, that's a teachable moment. Yes, you can use a Nurtec, Ubrelvy, or Nurtec, Rimegepant, Ubrogepant to break through their migraine, but maybe you can prevent it with continuous therapy. And so teach. And so it's commitment, probe for evidence, teach something, reinforce what they did well is point 4. That was such a good presentation. I fully understand from you exactly what you heard, what you saw, and then correct any mistakes. Here's what I want you to think about the next time. It's called the 1-minute preceptor, and it's pretty valid in the world of preceptorship. And so I think Project Echo is continuing on. In fact, they write me every once in a while and say, are you sure you don't want to come back and teach this? But there are such good preceptors out there that are teaching these techniques, because it's a hard thing to be a preceptor. And I know when I go in that day that I'm going to be on for 12 hours nonstop. But there has to be benefits, or I wouldn't have done it for 32 years. And there are benefits. And I think the other thing for our students tonight who maybe are looking for a preceptor, because that's the other trend, some programs require you to find your own, is make sure there's a match. Get a reference from friends who know this person well, because there are preceptors out there that are maybe not NP. There are a lot of facilities that are taking students as an adjunct to the workforce. And yes, I told you, I put my students on in their own schedule, and I explained to you why I did that, but there are benefits to that. And that is, it enhances our ability to see more patients, particularly acute visits, but it also gives the students really good experience as well.
Do you think that there are a lot of programs that offer these things like Project Echo for that type of support for preceptors? Because I have to be honest with you, I don't really see much of it here in my particular area of the country. Or maybe they have it, they just figured I've been a preceptor for so long that I don't need it. But are you aware of anything else anywhere else that they're teaching something like this?
I don't. These Project Echoes really evolve. They were really designed to bring people from communities who have lack of access to accessible specialists, bring them together so that everyone can talk through cases and try to problem solve and come up with learnings and from experts in the field. But no, it's actually the first, to my knowledge, but everyone around the country can log on to this Project Echo. You don't have to be from New Hampshire. We had people from California. We had people from Canada who were on Project Echo, who were there. And there's Project Echo around opioids. There's Project Echo around pediatric cardiology. Like, there's ones all around the country. So if you look up Project Echo, you can participate in any part of the world. And that's the whole purpose, is to bring experts to communities who may not have that access.
That's fantastic. And I hope that there are some preceptors who are here tonight that they might be able to get some benefit from them. We talked a little bit, but I want to come back to it since we're talking about resources for preceptors. And you had mentioned it in the beginning of the program, that preceptors typically don't get paid for being a preceptor. I'd love to know what your thoughts are about that particular payment.
I was talking about this today in my interview with NOMF as well. I think that healthcare is changing. I think that systems are discouraging their employees from taking on students because of workflow, because of RVUs, because of space, access to care, etc. It is a huge burden. Now, the government makes money available for precepting physicians. I want to know, why is that same money not available to precept and train nurse practitioners? If we're going to do it for physicians, we need to do it for NPs and physician associates as well. I have a colleague who says, I only take PAs. And I say, why? She said, because their universities pay me $6,000 a semester to precept them. And so here's what's happened. Again, schools are so expensive. I don't want any further burden on nurse practitioners. They're so expensive. But what's happened is called capitalism. So because the schools aren't paying, there are organizations that have formed where you can go into this organization and you can pay a fee and they will place you with a nurse practitioner and that nurse practitioner gets paid. So I believe, this is my own belief, and I said this today when I interviewed with NOMF, you need to know that what I'm saying is my own mouth. It is not representative of any organization with whom I work or am affiliated, particularly our certification jobs that you and I do teaching that certification. These are my opinions, but I believe that we have got to get in alignment with the time. And if you are asking someone to do work, it's time that we take it off the backs and we offer rewards to people who are willing to put their time and their effort in to train the next generation. Because if the schools do not do it, the students are going to pay on the outside if they can't find preceptors. And I think if you cannot find preceptors for your students, in my opinion, this is me, you ought not to be taking that student.
And it's so interesting because the majority of the schools around here, and my state is a teeny tiny little state of Connecticut. And we have 7 nurse practitioner programs, 3 medical schools, and 4 or 5 PA programs. We're saturated. Plus, we have all the online students who are looking for placements. And so it's very, very competitive for students to get clinical placements. But one of the health systems actually will not allow preceptors to accept payment. They take the payment away from them.
Shame
So
on
if
them.
I was,
Shame on them. Shame
I
on them.
agree. I agree. But this is what some of them are doing. And the other piece of that is some of the students, because they cannot find clinical preceptors, is that the fee to pay the preceptor is being rolled into their student activity fee. So the students end up paying for it in the long run. And I, like you, feel the same way, that there's enough debt involved, getting a good education, that I don't feel comfortable that a student has to pay out of their own pocket to find a preceptor. But I really feel like there's got to be an answer to this. And we will not solve the world's problems with precepting tonight, but it's certainly something that I would want to give some thought to moving forward in the future. And I'm sure there's some attendees here tonight that are saying, sure, I had to write that check.
Yes, and someone posted, agree, thank you for supporting this. Do you think that this is nursing's lack of voice or otherwise? Probably part of it, but I think that there's a movement afront that does not want schools to have to pay. And, we are an economic society and everyone has teeth in the game and everyone has a financial stake and money drives a lot of what happens in healthcare. But if you're going to ask me to teach a student and commit to 300 hours of my time and my staff, because students consume a lot of staff, they are doing, and yes, they're seeing some patients, but at the end of the day, I tell employers it behooves you to bring on students. Think about parallel scheduling. but B, it is your workforce training. It is your future workforce. You
Right.
have the ability to interview that student and bring them on. There is a primary care desert out there. People are waiting months to get care. We have the potential to solve that by bringing on students to train and feel like if they like it or not. And so I think it's a huge, I think it's a huge flaw in the system. And I do believe that as healthcare changes, the system needs to change.
I couldn't agree more. So we talked about a lot of different things, and I know that we're getting a little bit close to our time, but I would like to just talk a little bit about how you keep students motivated, engaged during their learning experience, especially if like they're not doing well. I had a stellar student last year. I mean, when I tell you she was probably one of my top 5 students in the 20 plus year I've been precepting, and she just excelled in the clinical arena, but was not doing well on an exam. And she was so defeated that it was really difficult to get her mojo back. How do you deal with that?
Yeah, I wish I could tell you that I was really good and effective at dealing with that. I mean, I have someone now in my clinic who's probably the smartest, the best NP, one of the best I've ever had, who just feels like I'm not sure that this career is for me. And that's so heartbreaking, heartbreaking. And
Sure.
I know I can't fix that. All I can say is I just want you to know that in 32 years of doing this work, you rank in the top 10 and you need to know that. And I encourage you to step outside your head and spend some time reflecting because I hate to see you throw away something that you're so damn good at. And you will make someone an amazing NP. Even if it's not in my clinic, you have a gift and don't throw it away. And who knows what that seed will plant? All I can do, I can't change it. You and I operate that way with our patients. Here's my job to tell you what I see. And I recommend it's your body and it's your job to decide if that's right for you. And I have to respect that. But at the end of the day, I think one of the hard parts is I feel like many students are not resilient, that bad things happen, everyone. They happen to every single one of us. It's not what happens to us, it's how we roll with it, it's how we deal with it. And so, we've all had parents die, we've all had dogs die that we just love so much, but life has to move and we have to be able to put on our big girl panties and rise to that occasion. And that may sound callous. I was
Yeah.
13 years old when my employer said to me, when my mother had attempted suicide, was in the hospital, and my employer said, Wendy, things that happen at home do not belong in this restaurant. I understand things are hard at home, but you've got to find a way to leave that at the door because here you have a job to do. And that may sound callous to a lot of people, but it really taught me when I go there, my attention is on my patients and doing what I was hired or what I know I need to do. And so working on resiliency and recognizing that every day is going to be hard. Do you say that every day? I say every day in my clinic, this is the hardest job ever. It's harder today than it was 32 years ago, I think. But you
Mhm.
know what? It's the best job ever. Who in America has patients come into you and say, I trust you with everything you say? If you tell me I need to do this, I will do this. I listen to you. And I think, how lucky are we that we are part of people's lives and we're part of their families and 4 generations, and they bring their grandkids and their great grandkids to us because they trust the work that we do. So life is hard, the work is hard, but it's an amazing job, and precepting gives such good rewards. It's hard, but I don't give up on it because we need people who are motivated and want to teach our next generation of NPs.
And it's so disheartening to hear people when they say, I think I made a mistake becoming an NP. And I always say, you know, it's probably the practice site that you're in. Think about going somewhere else. And you know, you were here with that journey with me. I stayed at a practice far longer than I should have. I was miserable 13 years and I almost left the profession. And if it wasn't for the nurse practitioner I currently work with saying to me, I understand you're not happy, come work with us. And I thought it's going to be like this everywhere else. And it was the best move I ever did. And the greatest compliment, as you get as well, is when a patient says, would you please take my mom? Will you see my daughter? Will you see my granddaughter? That is the greatest compliment that any patient could ever pay me, that they trust me to care for their loved ones.
So I know that our time is coming up, and I agree with you. I lasted 11 months, 28 days, 4 hours in the job. That was the worst job of my life. But I will tell you, it made me strong. It made me realize that I'm a good NP, and I don't care if you don't like me, and I don't care if you don't think that I am good. I know I'm good. And so, for those of you here tonight, and in terms of precepting, it's such a valuable resource for our NPs. And for those of you students, interview your preceptor, make sure there's a match. Make sure that that preceptor wants you to be there and that you've got support. One of the best things, my staff loves our students and they're like, I love him or I love her. Can you please hire them? It's like, no, we have enough nurse practitioners right now. But you know, the NPs, I say to the staff, the best thing you could do is become friends with the medical assistants and nurses in this clinic. Not with me. I don't want to be your friend. I don't need to be your friend. I have friends. Be friends with the MAs because they will have your back and they will save you time and time again. And they'll teach you. Open your mind to what you're seeing and what you're hearing because these MAs know their stuff. And they're huge resources to you, and they will pick you up when you haven't done something and say, well, Wendy always does this. Do you think you want to do it? Wink, wink, wink. And so I thank you all so much for your time. I know our time is up. Vanessa, I think that someone posted, thank you so much for speaking on an important topic. We as NPs, we need to take this on. I appreciate your boldness. I think you and I are not shy.
No,
People say a lot of things about me, and most of them are true, but shy is not one of them.
no, mine either.
Any other questions for Vanessa and I don't, there is a question and answer button. I don't see any questions in there. People have been posting some things in the chat, but we're at the end of our hour and it's a long day for everyone. Mandel, you are so welcome, Vanessa. She says, thank you so much for this wonderful dialogue. And it's been really,
Thank you.
I wasn't sure how we would fill an hour, but I guess you and I have a gift to give, right?
We never run out of things to say, but you know, I think that a lot of that has to do with the fact that we are so passionate about what we do as a nurse practitioner that we want to see everybody succeed. I want to see because let's face it, the generation that's here tonight are the people that are going to take care of us. So I would also like, Wendy, I want to thank you for taking the time to be with me tonight. It's always a pleasure working with you. And I want to thank all the attendees for taking the time tonight to listen to us. So until next time, have a great night, everyone.
Until next time, good night, everyone.
Bye. Bye, Wen.
Bye, Vanessa.